Hi, this is Dr. Kurt Wohler for Sunrise Functional Medicine. The title of this short video is Autistic Child with an Unusual Pattern of Aggression and Self-Injury. So here's our disclaimer. Understand that the information within this video is for educational purposes only. So there can be many triggers for aggression and self-injurious behavior, often seen in autism or other children, many times with special needs conditions. And so you have to sometimes break it down from a clinical standpoint. Is the behavior continuous or is it intermittent? Does it only happen once in a while? And if it only happens once in a while, is it linked to a specific type of situation? So I've had some kids, for example, who only get aggressive or sometimes become self-injurious while at school or with a particular therapist. So not every problem in autism is related to a medical issue. Diet can play a big role. Sometimes kids have tremendous sensitivity to certain foods like wheat or dairy or soy or artificial coloring or flavoring in foods. So you can sometimes pick up on patterns that way. Allergies can be a trigger as well. And then there may be some underlying physical problem, just generalized pain, a headache, gut-related pain in a child or an individual with autism who can't speak and tell you what's wrong, may manifest as aggression or self-injury. So there's a number of things that can be done to look at certain types of testing. The organic acids test, for example, contains certain markers, HPA for creosol. These are linked to the presence of certain types of Clostridium bacteria that are known to create neurochemical imbalances that sometimes can be linked to behavioral problems. So that should always be done. High oxalic acid can be something that drives behavioral problems because these crystals that get formed by the oxalic acid can cause pain in the body. Gut inflammation is another problem, very common in autism. And then constipation. Kids who just can't move their bowels often become agitated. So this is a patient case going back a number of years. At the time, this child was 7 years old. When they came to my practice, they had an autism diagnosis at around age 2. The major issues were lack of expressive language, poor development, poor social interaction, lack of interest, and a lot of self-stimulatory behavior. Now, prior to that, around a year, the pediatrician had suspected reflux because this child had projectile vomiting episodes. They tried some reflux medication and it didn't really help at that time, but at least it was suspected. Also, the child was very fussy and a picky eater. Now, significant behavioral problems occurred in the spring of that year that included a lot of self-injury, head banging, biting of the hands, and aggression, particularly around mealtime. So this actually occurred when the family was moving from Texas to Kentucky. And the child started to develop a lot of allergies. So itchy eyes, runny nose, sneezing. The new pediatrician that they had consulted with prescribed Zyrtec, and it did provide some relief with allergies, but the aggressive behavior still continued, particularly around meals. So the pediatrician actually referred to a pediatric gastroenterologist who performed an endoscopy procedure. And what was diagnosed was something called eosinophilic esophagitis. And so eosinophilic esophagitis is when we get eosinophils, part of the innate immune system, that infiltrate into the tissue of the esophagus and cause inflammation, and long-standing problems can really lead to restrictions and the passage of food. So this actually comes from a website called SlideServe. You can actually go to that domain name and watch this presentation. This was not the endoscopy of this particular child, but this is just an example. What came back from pathology was that this child had diagnosable high levels of eosinophil infiltration into the esophageal tissue, and they also had some mild gastritis. So they actually had some inflammation happening in the stomach as well. So what the gastroenterologist detailed in the pathology report again was eosinophilic esophagitis, mild gastritis, and so the child was actually placed on Zantac 75 milligrams twice a day plus a restricted diet. Now in most situations a restricted diet would remove some of the more common allergens like gluten, other grains, dairy, for example, soy, and maybe a few other foods. Sometimes you can also do what's called an IgG profile to be able to assess what types of food sensitivities exist. And then what they found was on further follow-up reports after the child had gone on a restricted diet, had gone on an acid blocking medication, was that there was a reduction in activity or inflammatory reactivity happening in the esophagus. But very impressively, what the parents reported in the short term, and this actually happened within a few weeks of the initial therapy, was that his self-injurious and aggressive behavior had diminished by 80%, and within 1 month there was no more issues. So something that had existed for quite some time was remedied by actually treating the eosinophilic esophagitis, but it took getting the endoscopy procedure to figure out what was going on. And so for the first time, he actually had typical eating behavior. So again, in the world of biomedical intervention for autism, it's not always necessarily about the next supplement or even what's the best diet. Sometimes we've just got intrinsic profound inflammatory reactions occurring within the digestive system that need more specific medical treatment to try to get that child over the hump, so to speak, with regards to their overall health concerns. So for more information about our consulting practice, you can go to mysunrisecenter.com. You can also call us at our phone number 951-461-4800. You can also email at scmedicalcenter@gmail.com. Again, I'm Dr. Kurt Wohler for Sunrise Functional Medicine. Thank you.